Hey folks, glad you could join us on yet another conversation on Business Redefined, your weekly most comprehensive look at the world of business, finance, and economics. We began the year, that is 2026, with a conversation around healthcare and healthcare financing and the developments which are happening, especially around universal healthcare coverage. And we want to continue with that conversation, and we are privileged to have the Chief Executive Officer of AGC Tenwek Hospital, and that is Mr. Ben Siele. Karibu sana.
Thank you, Julius.
Welcome on set.
I really appreciate it. Thank you so much.
For those of us who might not be familiar, tell us about AGC Tenwek Hospital, what you do, where you're located.
Thank you, Julius. AGC Tenwek Hospital was started way back in 1937. So we're actually commemorating 90 years,
90
next year.
Yes.
So that's a big milestone, and we thank God so much for that. So it was started by missionaries, actually World Gospel Mission, who sent missionaries to Bomet, and they started the facility as a small clinic then. It has since grown. From around 1960s, we opened up the inpatient services. When we got the doctor is called Dr. Sturi, who really helped to scale up the inpatient services and the additional services. We've grown over the years. In around the 70s, we actually started the inpatient services big time. In the 1980s, we also went into the preventive side of things. So we've established community health and development arm, where we're really reaching out to the community to tell them about how to prevent diseases so that they don't come to the hospital. And then around the 90s, we then went into more of the surgicals. We really scaled up the surgeries. And we also started the school. We are big we have a college, both for the clinical and also for chaplaincy. Okay. And then in 2024, we opened a state-of-the-art facility, that's a cardiothoracic center. So those are the milestones that we have really seen God help us in Tenwek over the years. From a mission perspective, we are a Christian community committed to excellence in compassionate healthcare, spiritual ministry, and training for service. So those are the core areas where we really are focusing on. And even as we build the next growth trajectory, we're really looking at making sure that we sustain the organization even in the next 90 years.
Wonderful, and 90 years is quite a milestone. But I'm very curious. From what you've described, it looks to me like you are fundamentally a mission-driven hospital. And how does your financing structure look like? Because you have got the mission element, yes, but still you have to do your day-to-day overheads and manage the business still.
Absolutely, yeah. Absolutely. So it's true, we are actually a mission hospital. We are a ministry of Africa Gospel Church. That's why the word AGC. So and right from the onset, actually the vision of the mission of the hospital was really to look at the compassionate healthcare. So and to your question, is a good question, because that is where we have a dilemma, because we cannot turn away patients who come seeking services from us, because that is the core of our compassionate healthcare. But then we still need to sustain our services. Yeah. So we've really tried to make it affordable, the services that we have through the support and partnerships that we have with quite a number of partners who really support us. So that really helps to bring down the cost of services. In fact, if you compare us with a number of the other hospitals, we are really affordable, so to speak. Number two is we are continuously building on systems to really help us be very efficient from a finance perspective. So we are enhancing a number of strategic areas to just make sure that we can be able to sustain our operations. Because when the patients come, like I said, we have to see them, we have to treat them, and the cost of treatment is high. So we are grateful to the partners who have come through to help us do that. Now, the other thing that I wanted to say is we receive a lot of support from partners. We have World Gospel Mission, who've really worked with us this journey right from inception. We also have an organization called Friends of Tenwek that's established back in the US, who help us also fundraise. And then we have other partners like Samaritan's Pass, who've really helped us, particularly in infrastructure development. But now we really need to maintain the operational funding and sustainability of the same. So we have to do that. While we look at support and partners, we have also started own initiatives to try and build sources and kitty, funds to be able to sustain these operations. So in 2024, we actually started a fund through a marathon. We call it Hearts in Motion Marathon, that we are trying to really reach out to corporates, reach out to various organizations, individuals who can then help us to build a kitty so that we'll be reaching out to these individuals. So that is very key, because sometimes it's more of a moral dilemma that we are faced with, because we have to treat the patients who come. And over the years, we've actually grown big time. I think I didn't mention at the point of intro, because when you look at 20 years ago, we were seeing about 80,000 patients through the hospital. That has since increased. Last year, we saw over 220 patients. So that's about two and a half times what you're seeing. So the growth has really
a huge expansion.
It's a huge expansion. So we really need to guard and ensure that we have sustainability, as it was. So from a strategic plan perspective, those are the risks that we are trying to mitigate against, to just make sure that we are sustaining, the operations and also protecting the resources that we have.
Wow, that's quite some innovative approach. I like the setup of the fund to ensure then you're crowding in capital from partners. But also in terms of, I'd imagine you have got a portion of your patients who come on cash basis and also come on insurance basis. How does that mix look like?
So considering the population that we are actually treating, is mainly the poor population, so to speak, because they don't afford a number of services in a number of these hospitals. So the sort of mix we have is we are about 70% of our patients are funded through SHA, the Social Health Authority. And then 20% is for other insurances. And then 10% thereabout is cash payers. So that's the mix. And it's not the ideal, what we're actually looking at. We really want to continue to up even the other insurances in a way that it is actually going to help us sustainable.
No, you're doing some good job in terms of ensuring you have a sustainable path towards the funding of the institution.
Exactly.
But on the expansion side, you are now in Nairobi.
Yes.
Tell us more about it.
It's good. Maybe you must have observed last week when His Excellency the President actually commissioned the facility in Karen. We will be at Karen AGC building, the ground floor, and we've come in basically to boost our sustainability. So we're starting to, we'll be seeing patients. Our big flagship is actually the cardiac care. So after establishing the cardiothoracic center back in Tenwek, we actually thought of then expanding the reach of our services by establishing centers like the current clinic that we are doing, to then have sort of a funnel that will take our patients to Bomet, to Tenwek. So we will be big in terms of particularly the diagnostics. So we'll be having a lot of diagnostics, the echocardiograms being done here. And if there is a case for the patient to be seen and maybe be attended to for further care, then they'll actually be channeled down to Bomet at Tenwek. But then we will still be having cardiologists, as part of the team that is going to be looking at the patients here in Nairobi. So it's a big milestone, actually, that we are establishing here. And it's not only cardiac, we're also expanding other services in Nairobi. We are thinking of having pediatrician,
Yes. Okay.
and also orthopedics, because we are also big in orthopedics.
Okay.
Yeah.
And many would be curious.
Yes.
I mean, leaving Bomet and your next expansion point is Nairobi. Why Nairobi in particular? Why not Nakuru or any other town for that matter?
So we still have plans to expand beyond even Nairobi. So we are starting with Nairobi. We still have plans to even open facilities in Nakuru, in Kisumu, in Eldoret, in Kericho. So we have that plan, but we really wanted to face it. But the easy one for us was Nairobi, because we already have an established relationship even with our mother church, to be able to start off that, and also the fact that we are the leader in cardiac services in the region.
Yes.
So we thought, well, let's really position it in Nairobi, so that then we can reach out to the patients who need these services in Nairobi. That will also help us in that mix, the revenue mix that we are talking about, because we are intentional in bringing up the other insurances, and we feel like the population and the niche in Nairobi is actually going to help us.
Okay.
Around that.
Your flagship and your iconic brand is on the cardio side, which, as we all know, doesn't come cheap.
Yeah.
And you've got consultants on board.
Yeah.
I'm very curious as to the arrangement you have with them to be able to ensure that then you extend affordable care, but not compromising on the quality of the care.
Exactly. Yeah. And that is actually the core, Julian, in terms of we are so intentional in ensuring that we maintain high quality care to our patients, and also affordable. And that is a fine balance. So we have established, so we have the Cardiothoracic Center, and it's actually the biggest in sub-Saharan Africa. And when you look at statistics, we do over 60% of all cardiac open heart surgery cases in Kenya.
60%?
Over 60%. In fact, we are even scaling that up. With the expansion of the capacity in our Cardiothoracic Center, we are even scaling up to about 80%. Very soon, we're actually going to have maybe way over 80%. So one of the things that we've done is through our training programs. Yeah. We've been very intentional in terms of building a strong pipeline of surgeons who can really help. So our training is big in Tenwek, and we are part of a program under PACS, or Pan-African Academy of Christian Surgeons. That is training surgeons to targeting them to the underserved areas of Africa. So we are one center of that, and we've actually built a very strong talent pool or capacity to be able to sustain these services, so that as we started the cardiac services, for example, then we were so intentional in making sure that we have the necessary pipeline to support that. So we are training that, and we have quite a number of the graduates who've come out of these programs are part of now the consultants who are supporting us in Tenwek. Number two is we also have partnerships with even other institutions and other hospitals. We are so privileged in Tenwek to have partnerships with other doctors in the US and in other parts of the world who visit us. They actually come for short-term visits, maybe 2 weeks, maybe up to 2 months, when they come and help us. And they are specialized in various areas. So not only cardiac, they also come in, be it neuro and other services. So that has helped us to sustain these services, and in a very affordable manner. Thirdly is that we also have volunteer consultants. Mm-hmm. Like I told you, we are a mission hospital, and a number of consultants do commit and are obedient to the calling to come to Tenwek, to really come and help us to provide the services.
At no cost to the hospital?
At no cost to the hospital. And that's a huge
blessing.
Generous. So as we speak, we have close to 30 missionary consultants who are in Tenwek to help us bridge that gap. Yeah. And that is a huge saving for us, a huge complement to the cost component of the entire model. So it's huge. Definitely, we also have the local consultants, not only from Kenya but also from the region, from East Africa region, others from Ethiopia, and they really very compassionate with the work that we are doing there. And as you know, in the world of medicine, a lot of the times it's actually more of a calling. Yeah. And they obey that calling and they come to Tenwek. And that's a big blessing that we are so happy.
That triangulates quite nicely in terms of how you are able then to ensure then the access is affordable, but still maintaining the quality of care. But tell us more about your training, because I think creation of that pipeline is what is critical to ensure you have a steady supply of consultants who then are willing and able to be part of this.
Yes. So like I said, our big pillar in our mission statement is actually training for service. So we're a big center of training. Yeah, and so we have the residency training for both surgeons and also family medicine being conducted at Tenwek Hospital. But we also have Tenwek Hospital College, where we are huge, and we started way back around the 2000s. So we have the School of Health Sciences, where we train nurses, we train clinical officers, we train advanced national diploma nurses, and even cardiovascular perfusion training, which is so specialized. And then we also have a School of Chaplaincy. We have the highest concentration of chaplains in Tenwek because of our mission background. So we have a school where we train that. So when you look at it, we really so intentional in making sure that we build the pipeline that is not only going to support us in Tenwek. In fact, a number of the graduates who come through these training programs, they are not necessarily taken up in Tenwek. They are actually served even other areas where it's underserved. So we feel like we're really creating the right impact across the nation, across Africa, and it's really helping us big. And even the the talent pool that we are creating in the college is really huge, because we are so intentional in even the sort of programs that we are having. When we started the cardiothoracic center, we needed to make sure that we have skills around even the perfusion, because we have a lung sort of machine that can, in the course of the operation, in the course of the procedure, then there's a mechanical provision for it to pump the sort of the heart. As you deal with it. So we are so intentional in developing those skill mixes through the programs that we are offering in college. So we thank the government through the Ministry of Health, through the Nursing Council, the Clinical Officers Council, because we work together even in creating this curriculum, and also the approval process that we need for all this.
Ben, it looks like your annual expenditure on infrastructure expansion must be quite heavy, because all the things you're saying, the training centers, the cardio centers as well. How does that look like?
Yes, so it's huge actually. Over the years, we've really managed to put up quite a big infrastructure, be it in the main hospital, and lately even in the cardiothoracic center. It was way over 4.5 billion, the putting up the cardiothoracic center. We've put up an emergency wing of the hospital recently through the USAID support. So we are lucky, or I would say we are so blessed to have the support, the infrastructure support, mainly from our partners and our donors. It has really come big. But then we take up the operational component of it.
Okay.
Yeah.
I'm being flagged. The time is running out, so let's begin dialing this down. 2 questions here. The first one is, this country and Africa is having a broad conversation around universal healthcare. And the whole idea is every person needs to be able to access quality healthcare at an affordable rate when they need it. Yeah. You seem to be having what I would think is a very successful model. Yeah. What are some of the lessons you've picked which you think can be replicated and help not just Kenya, but the continent?
Okay, thank you. The UHC model that the government is actually pursuing is great. In fact, it's really helping us big time with the sort of population that we are having, because they need the services as it was. So I think one thing that we really need to continue doing is really to expedite a number of these programs that the government has rolled out through the UHC. So we really need to expedite, because there are still some so what I would say, teething problems in terms of the entire process, the entire system. But we are glad that we are actually moving in the right direction. At least to be able to reach over 30 million Kenyans registering under SHA, I think is a big win. And we really need to tap into that. We also need to continuously work with the relevant institutions, be it SHA, be it DHA, to make sure that the necessary infrastructure is actually working. Because one big thing, or one big enabler, is actually the digitalization of the medical records. So if we can be able to really have it up and running the way it's designed, it's really going to help us big time. And then the conversation around the prompt reimbursements of the claims. I think SHA has really done well over the years. They've continuously improved on the systems and the conversations and engagement that continue with the facilities. But that can be improved to really make sure that the turnaround time in terms of the reimbursements help us to be able to continue providing the services to the patients. But I believe Kenya is actually leading the pack. When you look at Africa, I think we are on the right path in terms of the UHC model, and it's such a milestone that I must really commend the government.
Ben, let's close it here. Give us your parting shot.
Oh, thank you. So again, we are grateful for the opportunity to serve the people of Kenya, the people of Bomet, in Tenwek. And this is an opportunity for us to talk more and to tell our story. We really, I know time has not allowed us, but we have quite a lot of success stories that is in Tenwek. And we wanted to tell the public that we are in Bomet, and that we are even coming to Nairobi. One big component that that we have, Julians, is the spiritual ministry component. That as we serve the patients coming through Tenwek, we want to share the love of Jesus Christ, and that's one of the key pillars and differentiators for us in Tenwek, because the spiritual ministry is big. We want to ensure that every patient that comes through, we actually minister to them in the bed or in the OPD areas, and that way we incorporate and integrate treatment and also the holistic health to the patients. So we will continue doing that. We will continue working with the government and all the healthcare players to really make sure that we up our game, we meet the expectations, and we continue with our leadership in healthcare.
That is Mr. Ben Siele, the Chief Executive Officer of AGC Tenwek, right there in Bomet, and now also here in Nairobi, speaking to us about quality healthcare at an affordable rate, which all of us can be able to access, because remember, this is a basic human right, and giving us the nuances of the funding pipeline and how you can crowd in partners to be able to ensure you have a sustainable approach, even when you have heavy infrastructure spending like they have done. He said about 4.5 billion, just imagine that. We shall keep tabs on this to bring you the latest on healthcare financing as and when it unfolds, so keep it Business Redefined.